when one thinks of surgery, there's really basically patients thinking that there is something that's being changed and with an open incision, big incision, and things inside the organs get moved around or fixed. I think it's important to talk about the approach by the surgeons. One traditional way that's been done for many, many, many years is through an open incision. A lot of times patients come in and we have to do some revisions and as such, and patients know that a lot of patients would get long incisions. Laparoscopic surgery is done through small incisions, anywhere between 5 millimeter to 12 millimeters, which it's a very small incision. You may have multiple of them, but it's one that obviates really hernia, a chance of hernia development, one that also lessens the risk of wound infections. It's a very effective way to go ahead and treat patients. And one thing to say about laparoscopic surgery, that it's been around for a long time, but it is a set of skills that's undergone tremendous amount of change lately, such that it's prompted development of laparoscopic fellowships around the country and specialty centers around the country, such that the new surgeons coming along have these more, I guess, specialized training in order to deal with disease one way or the other through laparoscopic incisions and address them surgically through minimally invasive techniques. There are a lot of benefits to laparoscopic surgery. It serves patients well in many different fronts. Chances of wound infection, it is cut by more than half, as opposed to if you had an open surgery. Through laparoscopic surgery, there's very minimal risk of any wound infection. Hernia formation, that's another thing that is pretty large with large incisions. But proportionally, when you make an incision very small, chances of hernia development is decreased by manyfold. Also, patients return to work quicker because there's less pain. And that is a value that cannot be minimized, as getting up to walk quicker, getting up to go back to work quicker, and do the things that you're used to be doing is an important thing.